everyone received the news release that we issued earlier this afternoon. At this time, we do still have one confirmed case of measles in Tennessee for the calendar year. As last week when we did an update for you guys, we are not able to provide any information about the specific patient. We will be able to go through and answer your questions momentarily. I'd like to have everybody who's on the call from the media, please state your name and your organization, please. Anyone?
Elizabeth White, the Chinese Crime Sleep Rod.
Hi, Elizabeth.
It's Dorothy Sherman, WBES News 12 in Chattanooga.
Hi, Dorothy.
Zach Irby, WJ Sterling, Johnson City.
Hi, Zach.
Christy Nelson, Rockville News 12.
Good afternoon, Christy. Anyone else joining us on the phone from media this afternoon? Okay, we have some folks here in the room with us as well. Those of you on the phone, I will ask please that you mute your phones until you're asking a question. That way we won't hear anybody's hold music or any noise in the room where you are. We're going to start with the folks that are here in the room with us. Let them go through and answer your questions. If you guys cannot hear Dr. James's responses, please let me know and we'll make some adjustments here. But we'll hear from our folks here in the room and then we'll come to you guys on the phone for questions. Dr. James?
Hi.
Who wants to go first? Brett, let's start with you.
What are the conditions right now in Tennessee for measles, and what are our plans to how are we going to approach it? How are we going to attack it?
There's a very large outbreak of measles going on nationally with over 600 cases in 20 states. The good news is that so far we've only had one case in Tennessee, and we're trying really, really hard to keep the numbers here low. That means that even with a single case, we are trying very hard to get sort of general prevention messages out to the public. And we're also being very, very aggressive about tracking down individual people that may have been exposed to measles and be at particular risk of getting sick. So early on, like this is a time when we are very, very aggressive about following up.
How do we compare, I guess, nationally with vaccination rates and with sort of the normal protocols to keep the disease in check?
Far and away, the best way to prevent measles is appropriate vaccination or immunization. And we have a very, very effective vaccine. Our immunization rates in Tennessee are quite high. We're certainly in the middle of the pack nationally. So that doesn't put us at higher risk than other states. Though in general, a large majority of the cases of measles that we're seeing during this national outbreak are in that small proportion of the population that is unvaccinated. And that's something we'd really like to change.
Is there some sort of measurement of communicability of the disease? That's really a word. Like when you hear terms like Ebola or something, you go, wow, that's a very dangerous disease. Is there where does measles fall in sort of a danger index, if you will?
Measles is one of the most infectious diseases that we deal with. It's very, very easy to spread, and it's airborne. So it's spread by basically coughing, sneezing, even breathing in a room. It's also not a benign disease. I think a lot of people worry now more about the vaccine maybe even than the disease, because most physicians and people in the population have never even seen measles, and that's because the vaccine has been so effective. I will say, though, however, when the disease was widespread, it's a very, very serious one. 1 or 2 out of every 1,000 people who get it can die, and far more than that can be hospitalized or become quite ill. I think any of us that would talk to folks in our grandparents' generation or who were around when measles was common, they would tell you that they were very, very afraid of it. They took it very seriously, and no one would have ever refused vaccination when they actually saw how this disease affected people around them.
Would you say, we see this trend of anti-vaccine on social media quite a bit, and, and we're now hearing about measles. Do you think social media has played a role in people not getting vaccinated, and this is sort of making a resurgence? Can you comment on that?
We're lucky here in Tennessee that our rates of not being vaccinated in people who could be are pretty low, but you're right, nationally the numbers are going up. And in fact, in other countries, including many countries in Western Europe, the rates of not being vaccinated are getting very, very high. And that's very scary. Vaccines are very, very low risk. They're extremely effective. And even though it's a personal decision here in this country about whether or not to get vaccinated, that decision not only affects the individual who is deciding about being vaccinated, but it also affects people around them. And if unvaccinated people get measles, they have the potential to spread it to people around them, including babies who can't be vaccinated yet, people with immunosuppressive conditions, with cancer, people who don't have a choice. And so this decision affects not only individuals, but our communities.
But you would say social media has played a role in that?
Sorry.
Could you comment a little bit more on
Sorry
that?
about that.
Yeah.
I do think that as information travels faster in our age, and social media is certainly one of the biggest drivers of that, that it allows anyone to put out messages that can be seen by essentially the whole world, which means that many of those messages that move really fast simply aren't true. And sometimes things that are false or incomplete will rise really high in search engines. And so I think it's really important that people get information about vaccines and any medical issues from their trained medical providers, from reliable sites like CDC. Tennessee Department of Health has a website with lots of information, and to just use very, very good judgment about other sources of potential of information.
And with regard to that information, specifically that certain vaccinations can cause development of disabilities or something, is there any debate about what the answer to that is?
In the medical and scientific community, there is no debate at all about whether or not the measles vaccine can cause autism, which is what has gotten a lot of attention. It simply doesn't. There's an overwhelming amount of scientific proof that it doesn't. Unfortunately, that is a rumor that has lived on for many years, and it's hard to dispel, but people that are afraid of that now just absolutely do not need to be.
What's your main message moving forward from today to Tennesseans?
The number one message, I think, sort of with this warning shot of seeing a single case, is that anyone who can get vaccinated goes out and does it. And if you're not sure about whether you've been fully vaccinated, I would encourage people to check with their medical providers. We don't want people to be unnecessarily afraid. And so I think we do want to reassure people that anyone that we can identify that has been close to a case or is at particular risk, we are making efforts to go out and find them and personally communicate with them about taking extra precautions. If we learn about places that are more public, where we can't identify specific individuals, we will absolutely make that information known publicly, so that, but we would really like anybody, everybody, to do something that we can all do easily, which is get vaccines.
Let's say a parent comes up to you and says, okay, my kid's vaccinated. Do they have anything they need to worry about if a kid with the measles came to the school, or they have nothing to worry about?
This vaccine is so effective that if you are appropriately vaccinated, even if you're close to a case, you don't need to worry. The exceptions to that, pregnant women, people who have medical conditions that didn't allow them to be vaccinated, and that kind of thing.
Okay, if we have no more questions at the time.
We do.
Well, I was going to say, for those who...
here, we're joining in on this part late.
Okay, can you, wait,
We've been monitoring the
excuse me, can you please tell me your name and your media outlet?
Yes, sir. It's Paul Brown, WBIR-TV.
Good afternoon,
we
Paul.
have a
Wait a minute,
question.
Paul. We're going to take people in the order that they signed in earlier, so I'm going to call on folks one by one so we don't have those of you on the phone stepping over one another. So we'll start with Elizabeth with the Times Free Press. Elizabeth, do you have any questions this afternoon?
Yes, I do. I was wondering if y'all could give any more details about the confirmed case. Did that person travel? Do you know anything about where they might have acquired this? Maybe their age, anything?
So I can't speak about a specific case or where they acquired the disease. I will say in general, nationally, most cases are imported from other countries where measles is common. Unfortunately now, since this is an outbreak that's affecting 20 different states and there are hundreds of people with it, that's not always the case anymore, and it can be acquired in other states. It's not surprising at all that people that have this illness will have moved around, in their communities and potentially even traveled. There has already been a public announcement by Mississippi of some places where they have had the measles patient and the person that's known to have had measles travel through their community at specific sites, and they've made that message publicly available.
Okay, I'll have another, wait, hold on just 1 second, Elizabeth. If those of you who are on the phone and are not asking a question at this time, would please mute your phone because we are hearing some extraneous noise. So Elizabeth, go ahead with your next question, please.
And I just wanted to get some clarification on this case in Tennessee. Would you say this is part of the national outbreak, or how would you word that? I guess you wouldn't say Tennessee is having an outbreak, but you would say, could you say this is part of the national outbreak?
When the number of cases of measles gets really big nationwide, it sometimes becomes impossible to tell whether which individuals are transmitting it amongst themselves. So I would certainly put Tennessee on the list now of the 22 states that have measles cases that are sort of part of a national outbreak. We are very lucky that we only have one case now. And we're working really hard to keep the numbers low, but I will be very surprised if we don't have a few more cases because it's such an easy disease to spread. So that will be expected, but we will do everything we can to keep the numbers low and to be able to reassure the public that that far and away most of our population does not need to worry specifically.
Okay, thank you. That's all my questions.
Thanks, Elizabeth. Dorothy, do you have any questions for Dr. Jones?
I do. So the Alabama Department of Health
they have reported that an individual with a measles case traveled through Alabama on April 11th. One of the stops they made was in Fort Payne. Is that the same person that also traveled, made those 2 stops in Tennessee?
Yes.
It is.
Yes.
Okay. And also, I guess, it's safe for people to go to these places, right? Have you guys been, like, what does business need to, like, have they been, like, cleaning up, or have you guys talked to businesses to know, like, as far as, like, what they can do to prevent the spread, too?
You know, while measles is very easy to spread, it's an airborne disease, so once the air is settled, you know, the establishments are no longer a risk. So we generally say that once a person is out of a room for several hours, there's no longer any risk there. And people absolutely do not need to worry about about being in these establishments, certainly once the announcement is made.
Okay. Great. I don't think I have any other questions. Thank you so much.
Thank you, Dorothy. Zach, do you have any questions for Dr. Jones?
Yes, I do. With last week, one case being announced in Tennessee, and today, nearly a week later, with the locations being announced, why does the state take a different stance on waiting that long, I guess, for those locations to be released?
It can be a little confusing for people when information comes out in little bits at a time. We actually have a very consistent policy that as soon as we know any piece of information that is potential to that's important to protect the public's health, that we will let folks know. Unfortunately, it's sometimes hard for us to remember exactly where we've been in the last many days or exactly who we've been around. And so it's not uncommon for us to talk to people and even go back several times and ask more and more detailed questions. And they will have been reminded or remember on their own that they had been in places that they hadn't remembered before. As soon as we find out about those things, though, if the public needs to know, we will certainly make sure that happens.
Okay. With this one case, how soon do we expect to see potentially other cases since measles is spread so easily?
In general, people will develop symptoms within a couple of weeks of having been exposed. Again, this would be unvaccinated people because they're the ones that we're particularly worried about. It can be a little confusing because the early symptoms are very non-specific, so this can start out almost like, you know, the flu or a bad cold with runny nose, fever, watery eyes, and it's generally a few days later that the classic rash develops. So it's hard to put an exact number on it, but because of the way, you know, the speed with which the disease presents itself and is diagnosed can be variable. But I hope that we can make it through the next several weeks without seeing any new spread of disease to people that we haven't found already, that we're keeping our eye on to make sure that they don't.
Okay, and my last question, do people need to get the booster shots, and if so, are they readily available?
People just need 2 measles vaccines. Most of us that have, you know, been through the school system will have gotten both of them. The first would be between 12 and 15 months of age, and then the second is 4 to 6 years before kindergarten. We aren't recommending an additional dose for anybody, but for folks that haven't been completely vaccinated, it's very, very readily available. Virtually all primary care clinics will have it, and for folks that need it, we have it available in the health departments as well.
Okay, thank you so much.
Thanks, Zach. Christy, do you have any questions for Dr. Jones?
Yeah, piggybacking on his question. Should people who had the single antigen measles vaccine in the 60s, 70s, or 80s before the MMR was widely in use, should those people get a booster?
The issues that have recently been raised about particular dates has gotten a little bit confusing, and certainly when people start talking about the 1970s, 1980s, there's nothing at all to worry about. Very early on, in the first few years when the vaccine was available, there were two different types of vaccine, and one was more effective than the other. So right now, our message is that if you have not been completely vaccinated after 1967, that you go to your medical provider and ensure that you get caught up. If you've had your appropriate two vaccinations since then, you should be fine.
Okay. And if you have not been vaccinated against measles and you've already been exposed, is there any benefit to getting the vaccine after exposure?
One of the reasons that we try so aggressively and so quickly to find people that have a pretty good likelihood of being exposed to measles is that if we can find them within 3 days, within 72 hours of having been exposed, that a dose of measles vaccine can help protect them and prevent them from getting it. Once that window is passed, the vaccine will help you for future exposures, but won't help you for this one. There's also a much more uncommon medication that for infants that weren't vaccinated before, and people in special categories can get for a couple of days beyond that. But essentially for the vaccine, the faster the better. Which is another reason to get it before you need it, so that you don't have to worry about it ever in the future.
All right. I know I've read that the CDC said up to 90% of people who have someone they're close to who has measles or who are unvaccinated will likely get it. How much less is the risk of just occupying the same public space with someone who's infected?
We don't have really precise numbers about the probability of getting sick when you're talking about public areas, because people move around so much. The way air flows and moves around is different. So we can't put a precise number on it. I can say that it's one of the easiest diseases to pass along, but the longer and closer that you are to a person, the more likely you are to get it. And that's one of the reasons that we worry particularly about family members, people that have sat in the same car, that kind of thing.
Okay. And my last question, and thank you for answering my question, do you expect as the investigation continues to announce other sites where people could have been exposed in the days coming up?
Right now, we have made public all of the sites that we think are at risk at all from the case that we know about. If we identify that there are additional cases and have any concern that they would have been in public places that put others at risk, we'll absolutely make sure that that is known.
Okay, thank you. I appreciate it.
Paul, do you have any questions for Dr. Jones?
Yeah, and my apologies for interrupting. I dialed in late. We had some confusion here on our end. No, my question goes back to the areas that you all have determined this gentleman was at. What goes into that process? If it's like a documented access, say a direct doctor's office or a hospital, somewhere like that, where you have an idea of who's coming and going versus open access, like a convenience store or a mall or something like that, is that when you all determine to make the public announcement when it's more of an open area like that?
The short answer is yes. When we're making the decision about, how big of a circle of people to notify, we'll go to great lengths as far as if it was a doctor's office, getting a list of all the patients that were there in the last few hours. If it's a party, we'll get a list of everyone who was at the party during the period of risk. And in those situations where we're pretty sure we have complete information, we'll go and find them all. If there's a setting that's more public, like being in a restaurant, a gas station or something like that, then we really have to gather more information. How long was the person there? Were there other people in the establishment? What their symptoms were at the time. And we always err on the side of safety in terms of making that determination.
And do you know, did this person visit a doctor's office or an ER or somewhere like that when they were not contagious but did test positive? We've heard some. Go ahead.
I can't share information about specific patients, but I will say that in this case, like any other case in the past or in the future, that if, while they were able to spread the disease, they went to a place where the public has been exposed, we will either find you and tell you in person, or you will hear about that site publicly.
Okay, thank you.
Are there any other questions from those joining us on the phone? Any additional questions from you guys here in the room?
Can we have you just say and spell your name on camera? I don't think we got that in the beginning.
We didn't. Tim Jones, Jones, MD. I'm the state epidemiologist at the Tennessee Department of Health.